Hello guys, thank you. Welcome to our podcast. Right now it's 12 noon Eastern time. That is Atlanta time, and it's also 9 a.m. West Coast time. That's Los Angeles, and I think it's actually also about 5 p.m. London time. Welcome to our podcast, The Good with Dr. Joe. We have a lot planned for you today. Miss Snow, why don't you tell them what we're going to talk about today?
We're going to tell you how to take good care of your eyes, everything you need to do to make your appointment, and show you some of the equipment that we use.
Miss Snow is quite right. You know, we are supposed to check our eyes once every year. So a lot of people don't know this. You're supposed to check your eyes annually. So what you do is that
annually. That's once a year.
Once a year.
Annually.
It's not annual. It's not in a place.
No, it's not annual. It's annually.
Annually, yearly. Yearly, you're supposed to check your eyes. And let me let you know this. A lot of insurance, right? Vision insurance.
Vision insurance. Be sure, not health insurance, vision insurance.
Yes, your vision insurance actually covers your yearly eye check. And a lot of the things that we do at your eye check, yearly eye check, very simple stuff. Not very what? Painless. It's painless. Yeah. You know, so it's painless. So I do not understand why people shy away from doing the yearly eye check.
It's because if you've got vision insurance, most vision insurance pays for a yearly exam. You should take advantage of that because your premium has paid for it.
Absolutely. And you don't know what might be going on behind your eyes. And if you don't check it, you don't know. So what we're going to do now, before we come back and tell you how to prepare for your yearly eye exam. For yearly eye exam, let's take a look at some of the equipment. You know, what you're going to see when you come into an eye doctor's office. This is the retina imaging equipment. And what this does is captures the image of the retina so that we're able to diagnose, you know, and we can, with this, we can figure out issues like
diabetes,
and then you have macular degeneration,
glaucoma,
you have cataracts, and you have a host of other eye diseases that we can just analyze with this retina imaging.
Because the retinal imaging takes pictures behind the eye.
Yes.
Where things begin at diseases and like glaucoma, which is cancer, begin to start. So you get a head start.
Yes.
You catch it before it gets controlled.
Early detection is our goal. Over here, this is the Topcon auto-refractor. What this does is capture the refractive state of your eyes. This is how we know whether you have any refractive issues, which means can you see far, can you see near, can you read, especially in this age of PDAs, people on their phone, iPhone, on the computer, on iPad, and so on and so forth. This gives us a head start whether or not you need vision correction. And the next machine here is going to be the computerized tonometer. So this measures the pressure of your eye. So this tells us here whether the pressure is within limit. If it's within limit, we'll find. If it's not within limit, then we have to go investigate, find out why your pressures are high. Now, if you don't treat this, you end up with glaucoma. So it's critical. That's why you do a yearly eye check. And now one more thing I'd like to show us today, one equipment I'd like to show us today actually too, is the slit lamp and the phoropter. The slit lamp checks the cornea and really just based on the outer part of the eye, just to check to make sure everything is good on there. And then we have the phoropter, which gives us the finer prescription for glasses or contacts. So this is the subjective part of the test. And with this, we're able to give you a finer prescription. How to prepare. Now, the result, and this is with anything you do, whether you are in real estate, whether you are in the auto business, whether you are in the academic sector, whatever you do, in order to get good results, you need to prepare. So preparation sometimes can be the key to having great success. So here's some of the things you have to do when you are getting ready to call for your appointment. First thing we say is that always plan appointment. Don't do walk-ins. Go plan appointment. So I'm going to have Ms. Snow tell us, what do we need to do when you're getting ready to do your eye check?
I've got a little list here on what you need to do to have ready when you call to make an appointment. Be sure you've got the name of your vision insurance.
Critical.
And the person who is primary on that insurance. And the person who's primary, we need the birth date and the last 4 digits of their social. And if there's an ID number on your card, we would have to use that. That would be very helpful.
You want to get all this information ready even before you call. In fact, if you don't have it, call your insurance company, let them give that to you. I've seen a lot of people who go do their test, they didn't have this information and then they have to pay out of pocket. Why pay out of pocket if your insurance actually makes provision for that? Go ahead, Ms. Dell.
And you know, most insurances pay annually, that means yearly, for new frames and new lens, which is really a good thing, even though you might not need that every year. This way, you have a backup, and you can keep up, the women can keep up with the current styles.
They do also the same thing for contacts also. They also pay yearly for contacts.
Now, contacts have to have a yearly exam. That's the Georgia state law.
Yeah, so that means that by law, every year before you get new contacts, you have to have prescription that's valid within the year. So which means your prescription for contact is valid for 12 months only. After 12 months, you have to get another check to get new contacts. So how about actually calling in for the appointment?
Well, that's what we just described. When you call, these are the things you need to have ready, what I just itemized.
Absolutely, absolutely.
And,
how about preparing yourself for the appointment? You know, like making sure you dress comfortably. You know, you're not going to a park. You're not going to.
Well, the thing right now at this time of year, what we require is that you wear a mask and we take your temperature before you come in, and you keep your mask on the whole time you're in the building. And of course, if you have to fit contacts or take contacts in and out, we require you to wash your hands.
Yeah,
we're doing everything we can to be on the safe side with the COVID-19.
I'd like to just hammer on that a little bit. This is actually the CDC regulations or CDC recommendations.
Yeah.
And it's not only for eye checks or medical checkups. It's actually for if you're doing business, you're going to any type of business, you're going to any kind of buildings right now, either government buildings or retail buildings.
Well, you know, I go to get my hair cut. I've been twice now for my haircut, and I wear my mask, and everybody in the salon's wearing a mask, so I feel like it's perfectly safe. So don't miss your annual exam on your eyes because of COVID-19, because it's very important, especially, you know, as we just iterated, if you wear contacts, it must be done.
And here's one other point I'd like to raise about what risk you might be putting yourself in if you don't do your check. Okay, so now the insurance company, they actually put a lot of money and research towards prevention. And it's true, prevention is always better than cure.
Oh, yes, yeah.
Because there's really no true cure. You know, true cure means making whole.
Well, now you correct me if I'm wrong, but like with glaucoma and macular degeneration, if that's caught early, medication can retard it.
Yes, you can
slow
stop
down
it.
the and I think on macular degeneration you can even stop it, can't you?
Yes, you can. You can. So if you diagnose early enough, you are able to stop this or slow down the progression. Now, especially for glaucoma, you cannot reverse it. You know, you can't reverse it. Once the damage is done, it's done. You know, the same thing. Some levels of retinal detachment is the same issue also. So early detection is always very critical. Now, like I was just making a point about what insurance companies want to do. They want to prevent. So that's why your yearly exam is actually a preventive eye check.
Right.
You know? So here's the argument by the insurance company. So you understand, sometimes when they deny your claim or sometimes when they deny your procedure, this is how they reason. Okay. So you're supposed to check your eyes every year, and they pay for you to check your eyes every year. And they go a step further, and they require your eye doctor, especially your eye doctor, to call you every year. That's what they recall for. So now if you get a mail, if you get a letter in the mail or get your card in the mail telling you that you are due for exam, that is not just a routine thing. That's not a marketing. That's not a marketing.
That's not marketing. No,
no, it's not
that's
marketing.
That's being helpful to the patient.
We're actually following the guidelines and recommendations of your insurance company to contact you and remind you that you are due for your yearly eye exam, your yearly preventive eye exam. Now, here's what insurance does. Once we already done all of this, we have contacted you through mail, we called you, we send you text, we send you email, and you don't show up for the first year. And then the second year, you don't show up. And then the third year, you don't show up. Now, this is 3 years that you have skipped on having your yearly check. So let's say, God forbid, something catastrophic. Is that the word?
Catastrophic.
Yeah, something catastrophic happens on the 4th year. Now, the insurance, this is why the insurance require records. So the insurance says, okay, once there's something major happening to your eyes, the first thing the insurance is going to say, okay, let's see the records for the last 3 or 4 years.
Right. Well, when was your last exam?
When was your last exam? And then you come over and we'll pull our record. There's no record that shows that you were here in the last 3 years. Guess what? Insurance can say, well, on the fact that you have not been checking your eyes, we can deny the claim. And they are within their rights to do that. You know, the government cannot make them change their mind on that denial. So what am I trying to say? It is for your own best interest.
Right.
Especially if insurance covers. You know, there are a lot of people on this call today who are watching this podcast today who may not even know that they have insurance.
Correct.
In fact, about 60 to 80% of people that I see sometimes in our office, they don't even remember.
Yeah,
they don't know.
Let me insert here that if you have health insurance, it does not cover vision, dental, or hearing. The vision, dental, and hearing insurance is something separate. So just don't think because you've got health insurance that it's going to cover these other 3. You have to be sure that you also have the vision or the dental or the hearing. Very, very important. Very important.
And just to also let you know that most medical insurance will have an option. When you're signing up, you know, for the insurance information, they have option to include
the extras, I call it.
Yeah, the extras.
Like vision, dental, and hearing. And a lot of people think just because they've got health insurance, they've got the vision covered. No, that's not true.
No, it's not automatic.
It's an add-on.
Yes, it's not automatic. So you want to get that add-on, and then besides that, you also want to get information on your actual coverage. You know, because they will send something out in the mail. By the way, we're going to start taking calls soon. If you can just be patient with us for a few minutes, we're going to start taking calls shortly. And the number to call is the 678-708-4567. If you have any questions, either regarding what we're speaking about today or what we have spoken about before in our podcast, either from our channel on YouTube, you have any questions, just call in and we'll do our best to answer the question. Okay, so now, you after you've elected to add the option of vision coverage, you can, or you're supposed to, get the coverages. You know, what's covered, what's your copay, how many times a year do you get benefits, and how many benefits you have. Some people have 2 benefits, on one plan.
Right.
You know, so this is information you need to know. If you're not sure, ask your HR people, HR department. What's the full meaning of HR department?
Human resources.
Yeah, human resources. We have that information. Call your human resources department. Find out what is it about this insurance that I need to know. What did they cover, and so on and so forth. All right. So the other thing also you have to also do. How about dressing? You want to dress comfortably, don't you think?
Oh well, it really doesn't matter what you wear. You know.
No, Miss Lay.
You don't have to dress up.
Yeah, you don't have to dress up, but you just have to be comfortable.
Yeah.
You want to dress comfortable. You don't want to be too skimpy. You don't want to be too elaborate. You know.
Right.
You just want to be moderate. Just want to be moderate when you go. But the most important thing is that.
But I want to emphasize before we close that when you go to an optometrist or an ophthalmologist, the exam is totally painless. The equipment used causes no pain and no discomfort whatever. So you have no fear.
Nothing to be afraid of. No shot unless it's very extreme cases.
In the same way with children, it's very easy with children. If you bring your children in and you tell them before you come in, this is not going to hurt. It's just going to be looking in your eye. And
especially now that we're doing back to school.
Oh, yeah, back to school.
Yeah, we're going back to school now. A lot of children are going back to school. It's critical to check their eyes to screen. You can do screening. And I think in most states in the U.S., Medicaid covers the children's vision check. So.
Oh, does it?
Yeah.
I hadn't heard of that.
Yeah. Medicaid cover a majority of the children, especially if they are not on their parents' insurance. So you want to check with your Medicaid coordinator and let them figure out what you qualify for. All right, so it's about time for us to wrap up. It's almost we've been online now almost 20 minutes. So if you have any questions, we had a call coming in a minute ago and we couldn't capture that call. So if you have any questions, you have any comments, or any clarification you need about what we talked about today.
Or if there's anything you didn't understand.
Yes, anything you didn't understand, so it'd be good to take that. And let's also see if anybody's typing any question online. Sometimes we do miss that.
We have a question that says, what's the difference between the two different types of eye doctors?
Okay, so all right. So you actually have, in the eye care profession, you actually have three. You have the ophthalmologist.
Which is an MD.
Yeah, you have the optometrist, and then you have the optician. All right. So really, if you look at it clinically, the job of the ophthalmologist is supposed to just do surgery.
Well, an ophthalmologist is a medical MD.
Yes. If you define it in the eye care profession, they actually do surgeries and manage major medical eye issues.
Yeah, infections and serious problems.
Yes, serious problem. Okay. Now the optometrist is the primary care provider in eye care. So the optometrist does very minor incisions. They also manage minor ocular diseases, but essentially the optometrist does the refraction.
And what does an optician do?
Yes, okay. So now the optometrist does refraction. Now, you remember I was saying that the optometrist is the primary care. If the optometrist looks at you and realizes that you have a major medical issue, he refers you to the ophthalmologist.
The ophthalmologist, right.
Now, if what you need is glasses or contact, then he sends you to the optician. So what the optician does is actually fit the contacts.
Right.
The optician actually make the glasses.
Right. So
the optician makes the glasses, optician fits the contact, and the optician also helps manage also very minor medical eye issues.
And also fitting the frames to the face.
Yeah, fitting frames to the face.
And everything like that.
Fitting the contact. So those are the three professions: the ophthalmologist, the optometrist, and the optician. Next week we have very exciting, very, very exciting. There's been a lot of talk about the housing market.
Now, this is, everybody out there is interested in real estate.
Yes.
In the housing market.
Yeah.
and we're going to be talking about the residential market. I've been a real estate agent since 1979, and Joe has done a little bit of flipping. So we can kind of cover both sides of that. You're buying, you're selling, and if you're interested in flipping, he can give you a little bit of knowledge on that.
Absolutely. This is really very critical because the housing market right now, a lot of people are predicting. There's a lot of predictions here and there, but we're going to give you facts. We're going to tell you what we have done based on our research, based on what we have seen, what we have experienced ourselves. So it's going to be next week, live on Instagram. It's going to be 12 noon. And look out for some of our promo. We're going to do some promo videos to promote that podcast of next week. All right, so Ms. Snow, you have any last words for our people?
If you're selling, don't price too low and don't price too high.
Great advice from an expert. And thank you so much for tuning in today. We'll see you next week on The Good with
Dr. Joe.
Bye.
Bye-bye.